My name is Joanne Hoagland, and I am our Benefit Program Manager at the University of Virginia. So I'm going to go ahead and get started. Our benefit open enrollment dates are actually seen here on the slide. We're actually having open enrollment this year from Monday, October 10th through Friday, October 28th. So it runs for 3 weeks. And it's during that time you would be able to get into your accounts online in self-service and make any elections you want to make to benefits that have an open enrollment opportunity. And that's what I'm going to cover today is what benefits can I change during open enrollment, what benefits are having changes to them, if any, what stays the same, and how do I go ahead and enroll. I'll also mention a few new resources that we have available this year online that we're bringing forward to help folks make a good decision about their benefit enrollments, and also just where information is found that can help you make a decision. So I do start with a little bit of information about the health plan and costs, specifically because it is definitely a topic that affects benefits and things like premiums and what we offer in the program. This is something I kind of show every year as an overview to help kind of illustrate what it is we're up against with costs that we can't control, and I can kind of explain what that is, and what we do to try to manage those costs, and things we can do both as the university benefits office and also as employees to participate in those cost savings and cost prevention kind of activities. So I have 3 different kind of charts included in this one graph. It shows the UVA health plan costs in the past 6 years of activity for the claims costs. And in the middle section, it shows specifically a drill down on the pharmacy costs and those changes over the past 6 years. And then also dental costs, because dental insurance has been its own plan for the past several years now. So they're good things to kind of keep a temperature check on. We do have things like wellness programs and incentives. I brought with me some extra brochures today just to kind of illustrate some of the programs that Who's Well is offering this fall. But also that information is found online at who'swell.com. Our wellness rewards have been in place for several years now, and it's kind of a short-term and long-term goal, if you will. A lot of folks have participated in biometric screenings, and they've done that in order to get in touch with their numbers, which has helped people kind of get early prevention in order to maybe cut health issues off at the pass before they get into a situation where they have bigger health issues. And then there's the long-term strategy of by encouraging us to do things like exercise, stay well, be in touch with our physicians. It has ultimately long-term consequences for ourselves and for the cost of the health plan. Other factors like pharmacy costs that are represented in kind of the middle of the graph, we can do things as employees to help save money out of our pockets. Things like using the UVA pharmacy if it's convenient to fill a prescription, but also to use mail order services when it's convenient to do so, of course, for those routine prescriptions, considering generics when possible. And also there is a Healthy RX program that is offered through Aetna Services for those who have chronic conditions to help find savings with their pharmacy costs there as well. Pharmacy costs in the United States, not specific just to UVA, but across the nation, are on the rise. So by looking at ways to save, in those kinds of cost scenarios, it does help our wallets and also the kind of offset to the cost of the health plan. And then, of course, dental costs, by practicing routine preventative dental measures, we can also kind of, for the long term, help preserve our health in that way as well. Now the UVA health plan, when we look at its cost comparison, we also talk about ways that the employer shares in that cost and the employee. So we all have to pay premiums out of our paycheck to pay for our health insurance, for example. And we also pay things like co-pays and deductibles for certain services when we see our providers. So the university is also sharing in that cost for the premiums that are affiliated with the health insurance and dental insurance. and also pays through the health plan. We have a self-funded health plan to help pay for the services that we use. So we do what's called benchmarking, which is to compare ourselves to other peer institutions. We benchmark ourselves against employers of a similar size to the university across the nation even, and see how we're doing in that cost sharing. This slide in particular is showing our cost sharing as it's related to the COVA plan. So some of you, if you've worked here a while, probably recall that plan. That's the Commonwealth of Virginia's health insurance offering. So we look at ourselves in comparison to that as well. So what we see on our slide in this specific example is that UVA has a favorable cost sharing with the employee in relationship to how much the employer absorbs in comparison to the employee. So, with rising costs, it's really a challenge for many employers, not just the university, to try not to have to pass on additional costs to the employees. So that's why a lot of the initiatives to stay healthy and to also just be good consumers is really important. Now, part of cost discussion is also related to the number of participants we have in our health plan. So that has been on the rise here at UVA. We have hired more people institutionally. We share in membership on the health plan with the UVA Medical Center, UVA Academic, College of Wise is included in this benefit plan. So looking at January 1 of 2016, we had just under 16,500 employees enrolled in the plan. So it's a very, very big, big plan. And we have, if you add all the covered dependents in at that time, almost 32,000 total participants in the health plan. So all of those claims costs you saw would be related to this very high volume of participation. Now, we did also look at what changed in the enrollment between the three health plan options. So we currently have Choice, Value, and Basic. Basic did have an increase of almost 24%, Value 23%. Choice dipped a little bit down to 11%. And then if you look at the total participation of the entire health plan in that calendar year, looking back from January 1 of 15 to 16, it actually went up by 14%. So that's a lot of extra participants that joined into the plan. And that's due to the fact that we had some hiring. We're trying to grow as an institution. It also relates to the fact that we included the College at Wise into our population that particular year. So the plan grew quite a bit that calendar year. So that's a little bit of a background about the size and kind of the costing for the health plan. I'm going to specifically now address what's changing for 2017 calendar year. So for all options, Choice, Value, and Basic, we are going to start covering one yearly preventative skin cancer screening at 100%. So when you look at the preventative services on a schedule, skin cancer screening, one per year is now covered in full. We are removing the age limitation for applied behavioral analysis. The ABA treatment for children with autism will now have no age limit to it. We will be covering infertility treatment after diagnosis for a lifetime max of $15,000 for members of the plan. We are increasing out-of-network costs for all three of the options. Now, out-of-network means you're going outside of the Aetna National Network and most certainly outside of the UVA network to receive services. So those costs, if you're choosing to go out of the network, will increase in 2017. And we'll have the schedules that show you by plan option exactly what that increase is. This year for open enrollment, so when you go into your online account, if you've ever carried a spouse or continue to carry a spouse, you may recall signing that online affidavit form that certifies your spouse's eligibility for the health plan. That rule is still in place, but what we're changing is how you sign the form online. You actually you're not required, you don't have to sign it annually in open enrollment. We're going to assume that if you don't do anything, your spouse continues to have the same status and remains eligible for the benefit. This is again just for health insurance. So if we don't see a change in open enrollment and your spouse is currently covered, we're going to assume things have stayed the same. That being said, if you're newly adding a spouse for open enrollment, you would have to sign that form to bring them onto the plan to let us know he or she is eligible. We're also, just going down to the next topic, for Value Health, we're also lowering by 50% the copay and copays for outpatient mental health and substance abuse for the Value Health option as well. And Basic, the high deductible health plan, we're reducing the health savings account for the family tier from $2,000 to $1,500 if you're in that group. We're not changing employee children, or employee spouse. We are also taking the in-network out-of-pocket maximum and increasing it from $6,000 to $6,650, and for family from $12,000 to $13,100. So here's the monthly, and I emphasize the word monthly premiums because some of us are paid biweekly. So we would take this dollar figure and divide it in half to get to the per paycheck cost. So what we have on the right-hand side of each dollar figure in each column is how much each premium is changing per month. Okay, so these are the 2017 active employee health premium increases. They range from no change at all to $29.50 more per month. And the above rates are, of course, not reflecting any incentives we might earn throughout the year for Who's Well rewards. So here are the UVA dental plan and Davis vision premiums. I've presented them side by side. We are not changing any of the plan design for the dental or for the vision. So this is the information that would be changing. It's specifically premiums. So by way of example, similar to the slide before, if I am in family membership in basic dental, I will now be paying $7.25 per month. So divide that in half to get to your per paycheck cost. And that's an increase of 25 cents per month for that particular person who's enrolled in that. Davis Vision is on the far right column. So if I have employee-only membership for $6.45 per month, I've had a premium increase of 16 cents per month. So we've heard you. We're trying to make this easier for you in self-service. If you like the coverage level you have in these plans, we're just going to default you into the same. That being said, if you want to make a change, open enrollment's your time to do this, to let us know what you want to participate in for 2017. So you would go into self-service, make that election. If you've never done these benefits before, that would be your time to go ahead and sign up for them. Again, October 10th through the 28th. Now we have lowered the minimum this year for these plans to $120. The reason we did that is we have a lot of people that are hired at the end of a calendar year, and they may want to do less. Maybe they're just signing up for a very few last months because this is a calendar year benefit, and they want to just have a lower amount to sign up for in that last few months of the year. So we're trying to help new hires out and give them a lower dollar amount. But you can actually go all the way up to the maximum, which is $2,500 for the healthcare flexible spending account. And the health savings account is a bit different than the FSA. So I see some heads nodding. Maybe you've participated in a flexible spending account before. You have to be in our choice or value plan or have a comparable plan elsewhere through another employer. It just can't be coordinated with a high deductible health plan if you're in a healthcare FSA, because it's a use or lose account. Here at UVA, for our flex spending benefits, we have a grace period of March 15th of the following calendar year. So if you couldn't make that, spend out that account by 12/31, you do have a little window of time that you can still spend it into the next calendar year. I'm going to skip kind of to the bottom of the slide and say similar in structure is the dependent daycare flexible spending. And that has a maximum of $5,000 allowed. And that is used for eligible daycare and other child care related expenses. We have a full list of that available if you're interested. And that's for children up to the age of 13. And that literally goes through their birthday. So you want to be sure if you have children who are aging older than age 13, that you're considering that benefit and being sure to reduce accordingly if that applies to you. We also have a health savings account if you're in the high deductible basic health plan, so that's kind of the middle section of the slide. And that is a much different benefit. It functions similar to an FSA, so you can use it for out-of-pocket health, dental, vision expenses, but it's a benefit that rolls over from year to year. So if you are in a high deductible health plan, you're paying less out of the paycheck, but you're paying more out of more of a deductible, so it's kind of a trade-off. So this health savings account is provided in order to help you offset those costs. Now UVA does contribute seed money into this account, so if you're single and you're in, let's say at the start of the year, January 1, the university is going to contribute $1,000 in seed money to that HSA to help offset the cost of that high deductible. If you're employee plus more than one, the seed dollar amount is $1,500. So if you're in that optional retirement plan, you also can purchase additional life insurance coverage if you want to. Okay, you can purchase 1, 2, 3, or up to 4 times your annual salary. And this policy is now also bundled with accidental death and dismemberment benefits. So you really have both coverages at the same time. You can consider purchasing additional coverage as well for spouse and for children if you're in these policy. And this is a good time to examine your life insurance really to make sure you're adequately covered. If this applies to you, if you're in these retirement programs and this is your life insurance vendor, just consider looking at your options, review what you currently have as your coverage, and see if you think you have the right amount of insurance. Again, before I'm done, I'm going to talk about some of the resources we're bringing forward to help kind of do that kind of an analysis online. And you also are able now, if you're in this plan, to enter beneficiaries online. So you definitely want to review that information. Now this fall I had mentioned that we had a brochure. I left extras on the back table there, but we have our seasonal fall Who's Well reward offerings. So they're pictured here on the screen. It's a 3-step process. You can do 1, 2, or all 3 steps, whatever interests you. And this fall, we don't usually offer this, but this year we are. We're allowing spouses to participate. They were always eligible to participate, but spouses can earn the rewards this year, which is a really nice feature just to give some additional incentive to have your spouses participate with you in this offering. So you can, step 1 is submit a physician screening form or complete a biometric screening, whichever is easier for you to do. We've been offering the biometric screenings across grounds, but some of you may have already seen your doctor this year and have your information and your numbers, so you can just fill out the form and send it in to the number on the form. You can also complete an online health assessment at myactivehealth.com. I just want to reiterate the deadline for all 3 steps this year is October 28th, so be sure to give yourself a little extra time to get that done. It's very good to just kind of get everything logged in as you can. I do get the question though, what if I was on vacation, I got behind in my logging of my steps, or if, hadn't plugged in my Fitbit in a few days and I need to catch myself up. That's perfectly fine. The system can accommodate you catching yourself up on your workouts in the login section. Now new for 2017, we're trying a one-time reward payment, and it's going to be in the first February paycheck. This does allow, we've got a lot of feedback that the recurring model, so the one rewards that we're hitting paycheck by paycheck, is nice in some aspects, but the one-time is also nice because you get it in one lump sum, and it allows you to control, what you do with it. So if you wanted to invest it and enroll it into your retirement, set it aside, or use it for maybe a special occasion to reward yourself for all the good working out you just did, it gives you that kind of freedom and flexibility. We're going to see how it goes. We had done a one-time reward payment for our Spring Fitness Challenge, and people seem to like it, so we're going to try it for the big challenge this year. And then of course we have, again, our Health and Benefits Expo that we've been bringing forward every fall. We really hope you join us, and we see some of your coworkers there as well. We've been increasing our attendance, and the first one is on October 12th at Newcomb Hall beginning at 8:30, and it runs into the afternoon. It's a really great way to come and meet our benefit vendors. They're all gathered there, eager to speak with you, so if you have questions about your benefits, literally have the vendors right there at your fingertips. So it also features a lot of activities and a lot of informational sessions and ways to further take advantage of those Who's Well offerings that we enjoy. So we really hope to see you there. If the Newcomb Hall location or date isn't convenient, we have a second at the Medical Center in the big dining conference room at the main hospital complex. So we have that the next day beginning at 7 a.m. So we've also received a lot of feedback about how we are in touch with people. We do mailings, we send emails, and I'm sure many of us get a lot of those. So we're trying something new this fall. We're offering, just for open enrollment, text messaging. So if you text UVABOE to the number 88202, we're going to send you open enrollment reminders. There's one text you would receive to let you know that you're signed up, and then there would be no more than 3 additional texts throughout the open enrollment period to let you know, hey, open enrollment's beginning, or don't forget, it's near the end of open enrollment. So we're doing this as a way to try to get the message across to our new mobile generation, and hopefully you take advantage of it or spread the word for those who find this an easier way to communicate. Now, we talked about resources besides communications. I just wanted to mention we've brought back, if you recall, we had this a few years ago, Ask Alex, the virtual benefit counselor. But we're bringing Alex back to speak to all of our benefit plans, especially during open enrollment. We want you to have these resources available to make cost comparisons between the health plan options. So it will, when you enter into the Alex conversation, it's going to ask a few questions about you. This isn't information that we gather. It's just kind of general, like what's your employee type, so it knows what pay cycle you're on. And that way it actually can introduce information to you that kind of goes based on your premiums and your pay cycle, but then it talks about how you're using the plan and asks some questions there. So are you using the plan a lot, very little? And it kind of does some cost analysis. It's just a recommendation. When you're using Alex, you're not really signing up for your benefits. It's just a really good way to kind of see the plans side by side and give you that additional information to help you think of it in the context of what you're paying out of your paycheck versus how you're using the benefit. And again, it's a recommendation. So if you decide, well, it's kind of 50-50 decision, it's really ultimately up to you what you want to go with. It's just a resource to help you consider your options. It takes you through dental, vision, all the open enrollment offerings. And there is a conversation in there about life insurance. So no matter which life plan, if you're in the VRS or the ORP, you can use that tool to talk about how much coverage should I have, what's going on in my life, do I have enough coverage for my family? And so there's a resource in there for that as well. Now we have our open enrollment website. I will confess it is not up online today. It will be a little bit closer to the start of open enrollment before that becomes available, but it will be there. And the first day of open enrollment, again, is October 10th, and it ends on Friday the 28th. So be sure to sign on. We have this year brought the benefits enrollment system to the same landing page as where you go to look at your time cards or change your tax withholding information. It's the integrated system. And I mention this because every open enrollment, a lot of individuals have said, I forgot my password to get into the system. So we're hoping you find this access point easier for you. You can actually use the reset your own password feature if you desire doing that. Our customer service office can also help with resetting of passwords, but if you want to, you can reset it yourself just by clicking the link. So it's a good idea to go in ahead of open enrollment, make sure you remember your password if you have time to do that, just to kind of get back in there and get familiar with it. And you would just select the benefits from the menu to get to self-service for the benefit self-service this year. I do mention that there is another system if you're employed by UVA Medical Center called PeopleSoft. So maybe you have a spouse or somebody in this room maybe has worked there or works there, and they go in through their portal, of course, during the same dates, October 10th through October 28th, to make their benefit selections.